And we also thank God for the gift of rain that has been a blessing to us in Karamoja. I don't know that the rain that comes August, I don't know that is also of agricultural importance. Yes. Hopefully it should be of value to us. Yes, welcome back. Now, we've listened to quite a lot of things. We had to squeeze apologies, but normally this agenda, today's agenda is, we normally do it as just a joint review mission. But for this year in particular, we had to blend two activities into one. And that is the EOC launch, together with also understanding some key public health situation review, and then also looking at some key interventions that we have done, and the essence and the necessity of having response strengthened in one way or the other. So we have listened and we've had some key asks from partners. And this afternoon, we also the key issues around one that requires us to heavily participate in this, as the way it is called One Health, so it means we are still one in all aspects. Health is becoming so divergent. We are kind of evolving understanding. The earliest health was only known in the hospitals and in health facilities, and then it came into establishing now in health systems and structures. And the public health was far away from the health facility. Again, some of them were linking up. But now public health is part of the health system fully and is heavily integrated. And you see now public health departments leading the other key technical areas in inventing from the regional referral hospital, reaching out to the rest of the districts. And now we are going beyond even public health department. We are now saying we are crossing to One Health, because we get to realize that every individual is very important in responding to health. The health workers have tried their level best. They have realized the reverends and the bishops command a very big audience. We have learned the fact that according to the churches, we know that a word just from a reverend, when he says, all of you who are immunized, you see the faithful believers running to go and immunize. We remember during COVID when some of the dissenting voices from some other religious leaders created some mindset that made our COVID-19 vaccination uptake quite hindered. And that shows you how strong the religious fraternity is. Likewise, we also know that the gateway to our manyatas in Karamoja is about elders. Looking at elders, the MPs, the politicians. So if the elders do not say anything, some of us who are health workers, even if you go to the manyata, they will not listen to you. And so some of those opportunities and recommendations are also additional asks that we continue requesting the cultural leadership. I am aware the Karamoja has a whole, I think, kingdom, it has a chief and the whole cabinet. The other day there was some news. I don't know how functional that is. So, yeah, okay. I think I did not give you a comment to give, but most of us as partners, we write those good scripts. We will be doing a lot of behavioral change packaging through the Manyata heads. and then it ends up there because the issues, the gateways, you need to make your gates very clear for us to. So that is one of the key icebergs that I am giving us welcoming you back and yet it is very, very important in this engagement that the cultural sector has to play a very big part in Karamoja. Likewise, the religious faith-based leaders. What do you think we bring on board in our sermons? Yes. Ladies and gentlemen, we had a presentation from partners, and I know we had a presentation from Pheoc, but there is something that is very interesting, ladies and gentlemen, and it is a very strong public health problem in the country, in Africa, and Uganda in particular. There is a big problem called antimicrobial resistance. Now, we are getting into a catastrophic state where the antibiotics we have are no longer going to work for us because we are abusing most of these drugs. Some of them, the other day I read some of the findings from the veterinary side, and you see lots of resistances, more than 90%, even of the drugs that we already use among humans. And that's why One Health is quite very significant. We are reaching a point, there are drugs we still use for TB, but in private settings are being used to treat urinary tract infections. And the people we are giving these drugs to swallow, they only swallow for one day, and then tomorrow they stop swallowing because they swallow once and they get better. And then the bacteria reorganizes itself, say we are now going to attack this antibiotic. So that is quite a very big problem. And the clinics that we have around the drug shops, most of us here are culprits of self-medication. And when we self-medicate, we also do not complete the doses. So some of those are key issues. Now, I think with support from Pheoc, I think there is a key comment I want to ask Dr. Kolik from just in 2 minutes to give us a slight snapshot on that antimicrobial support and some of the other things.
I would just like to apologize to the house that I forgot to mention some work that was done by Pheoc and the training which I also attended. So I've already apologized to her. And so she can go and tell you what was done.
Good afternoon, members. Good afternoon. By the name Dr. Yoko Jennifer. I work with Pheoc. I'm supporting the One Health project. The One Health project, we have many partners working with us, and our focus is in two districts, that is Morota and Apap. We are working with the CRD, and their area of focus is on animal health and the environment, as we handle the human side. Together, we are working with Makerere University. They are going to focus on research, basically on the prevalence of the zoonotic diseases in the region, as well as the resistant and susceptible drugs, especially the antibiotics. We are also working together with Maternal Hospital, and ISP is one of the partners working together with us. In these two districts, the project is going to run for 3 years. It started in May 2023, and it's going to run up to 2026. Our focus, as looking at the human health, we are focusing on antimicrobial resistance, And we are also focusing on functionalizing the One Health at the district. When we look at the functionalization of One Health committee at the district level, we were already able to conduct a training for the district officials, including the a committee, the one with Ministry of Health has already been signed. We already formed the One Health work plans in the 2 districts, and we are yet to review and start the implementation of the activities at the One Health. When we focus on the antimicrobial resistance, we are working with the 2 main hospitals, that is Moroto Regional Referral Hospital and St. Matai, with 16 lower-level facilities, both in Moroto and Apak, 8 in Moroto and 8 in Apak. Under antimicrobial resistance, we are strengthening the IPC practices in the 2 hospitals and the 16 lower-level facilities. We are able to build the capacity by training teams both in the 2 hospitals and the peripheral facilities on IPC practices, and we are also strengthening the antimicrobial stewardship. We were able to support the Ministry of Health to train also our team on antimicrobial stewardship, and we were also able to carry a number of activities. In antimicrobial stewardship, we were able to conduct a prescription audit that is looking at the prescription practices at the outpatients, both in the hospitals and the peripheral facilities. And we were also able to conduct the post-prevalence survey, looking at the prescription practices in the inpatient. And based on these activities, we have been able to conduct the mentorship so far in the lower level facilities. The next in line, we shall be doing the mentorship in the 2 hospitals. The same to the IPC practices, we were able to conduct a number of activities. We were able to carry the assessment on IPC practices, and also we have conducted a mentorship on IPC, and we shall be conducting in the hospital. And then the other area we are focusing on is strengthening the microbiology laboratory. In Moroto, there is already existing microbiology. We are strengthening its capacity by providing the reagents to ensure the sustainability. And for St. Matai, we have already established a microbiology unit, and I think very soon we shall be able to do cultural sensitivity. And we are also able to attach 4 health workers, that is the microbiologists, both in Moroto and Matani, 2 in Moroto Regional Referral and 2 in Matani Hospital. I think on that is the far we have come with the One Health program, which is focusing on the 2 districts of Moroto and Apak. Thank you.
Thank you, Doctor, for those insights. We wanted to have that. We want to cross into our last session. Could you still have a comment? I know nutrition is going to be an issue here, and it's a problem. Yeah, that's why food is a very important thing in Karamoja. Just in a minute, a comment.
Good afternoon. First, apologies because my presentation was corrupted and I could not share it. but I wanted to just highlight about the World Food Nutrition Program, which, as some of you have indicated, there was a shift, but just to clarify, World Food Program does manage moderate acute malnutrition within the sub-region. Originally, we were in 9 districts, but following a series of consultative discussions, we did make a shift. And the shift was to focus more on prevention rather than treatment. So in the districts of Karenga and Abim, we took a livelihood approach, and then in the rest of the other districts, we focused to balance both, one, maintaining treatment in specific sub-counties which were prone to drought, but also have the high caseloads. And then for all the other sub-counties, the shift focused on livelihood-related interventions. So where we still have the treatment activities, meaning that we are identifying the cases of moderate acute malnutrition and managing them, we are also supporting in the scale-up of the outreach services, immunization, deworming, antenatal care within those areas. And then, but I think that one of the key things to appreciate that when it comes to health, there is always going to be a component of nutrition that we cannot underscore. And also to emphasize that the best nutrition is always when we prevent. So the cases that come to the health facilities are always in the dire need of treatment. So the prevention activities are still ongoing, and we also have the blanket supplementary feeding program, which usually runs within the rain season. So I think those are the few remarks I can give about the World Food Program.
Ladies and gentlemen, I know we have a key, we can't miss this meeting without having comments from one of the key stakeholders in terms of relationship between the regional referral hospital and the districts, and two, patient protection is very key, quality and standards. And the Department of SCAP Ministry of Health has Dr. Kim is here with us from Ministry of Health and Department of SCAP to give us a brief highlight talk on quite a lot of good things, engaging the regional referral hospital and supporting the districts. Thank you so much. Welcome, Dr. Kim.
Thank you, my chair. Good afternoon, delegates. Good afternoon. It's a challenging time immediate after lunch. I bring you greetings from our commissioner, Dr. Karamoja, who has not been able to be with us, but I know you know him. He has been supporting this region for quite a long time. I'm Dr. Chief Officer, Medical Officer, the SCAP department, that is the Department of Standards, Application, I want to talk about this. I've been given a little time, but I want to talk about strengthening better service delivery systems in our country. And okay, I think in interest of time, allow me to continue as out. Yes, the current strategy that the ministry had to improving health service delivery in our country is through what we are calling the regional referral hospital
support mechanism or strategy. I'm sure many of you are now aware of, but this afternoon I want us to take you through the guidelines for implementing that strategy. Briefly, the rationale for the next. Briefly, the rationale for that is that Ministry of Health is the counterintelligence in executing its roles due to the increased population and increased number of local governments and respective versus the respective number of Ministry of Health team that it has. We all know that districts have now more than tripled since the year 2000, from before by last year. World cities have also increased from over the only Kampala city to over 11 cities currently. So as a result, there is increasing operationalize the regional planning coordination, supervision, and monitoring of interventions and stakeholders. Fortunately, the Ministry of Health already has the regional structures which has capacity to implement and which are also geographically well dispersed to serve as centers of excellence for this. And we also have existing legal frameworks, structures, and platforms to favor this strategy. Why these guidelines? That there was no implementation guidelines for these regional referral hospitals to execute this new mandate. The current Ministry of Health support supervision of care interventions in health facilities within the academic areas. Okay. So what's the purpose? To standardize approaches that will be used by regional referral hospitals to execute this new mandate, to operationalize decisions made by Ministry of Health regarding the regional referral support mechanism, and also specifically provide strategic guidance on prioritizing methods of operation to be used for the regional referral hospital support, and describe key roles, responsibilities, and functional relationships of key players in the implementation of this new mandate. Objectives. The general objective is to provide guidance for the implementation of this mandate, and those are the specific objectives. One, to describe the implementation structure for the regional referral hospital support strategy. Two, to describe the roles of the different actors. To describe the hub and spoke model, and guidance on the use of the data for continuous quality improvement interventions, and for the regional referral hospital support districts and the state. So the audience, so all delegates, you are the people that you intend to talk to, the directors of regional referral hospitals, heads of public health departments and regional referral hospitals, the THOs for cities, municipalities, government and IPs. Yes, maybe from legal angle, these guidelines have been aligned to these relevant legal documents. Our Constitution, the Public Health Act of 1935, the Local Government Act of 1997. For this strategy, the regional referral hospital support will follow the existing geographical catchment areas and will utilize the hub and model, and in that, the regional referral hospital will serve as the hubs of cascading the same quality of services to lower level facilities in their regions, working together with districts and local and oversight coordination and support to the health institutions. The regional referral hospitals will mainly target the general hospitals and health center force, which in turn expected to provide similar support to their lower facilities, that's the health center 3 and 2s, and of course the community. So the result of this support will be a functioning regionalized health, a regional referral hospital, with strategic partnerships of regional actors with capacity to jointly address critical oversight gaps training of effective implementation of national programs. Yes, briefly, the role of the regional referral hospital in this strategy. One, enhance leadership and governance mechanisms for oversight and coordination, strengthen program management and support for delivery of budget interventions, strengthen and coordinate referral, provide standardized what implementation across the region, and strengthen laboratory systems, human resource capacity for financial and public health oversight. Next. Areas of support, supervision and mentorship, providing improvement, that is through functionalizing the joint committees, capacity building for regional referral hospital services, coordinating related programs in the region, integrated disease surveillance and response, regional health research operations, community health, and laboratory advocacy, which I'm sure our monitoring regional referral hospital. Frameworks and structural arrangements. So the Directorate of Governance and Regulation will spearhead this implementation. That is, it's CAPD, that is the Standards Compliance and Patient Protection Department, will be the Secretariat of the Regional Referral Hospital. Sector financing, Directorate of Public Health, National Risk Control, and Info Services. So the Directorate and the Secretariat coordinate the regional hospital support through the Regional Referral Hospital Public Health. Interactions are through Public Health Department. Next. Brief about frameworks and structural arrangements. So the Regional Health Forum, this is the purposing of the different regional committees to take care of the current regional coordination teams implementing the regional referral hospital mechanism and the various point of care interventions and streamlining. Brief about the composition of the regional forum. A representative of the regional referral hospital, top management, the regional program for persons, heads of health services for cities and municipalities, also representative of health, the director of regional referral hospital, will be the chair of the forum, and the regional referral hospital community health department, that is now the public health department, will lead and constitute and lead the regional referral hospital secretariat, while the district office expected to be co-chairing and on a rotatory basis. This because this year they expect another district to constitute. Under the regional referral public health department, the department shall be responsible for initiating the planning and implementation of the regional referral support to the region. The district and urban health authorities are expected to organize quarterly performance reviews to assess the status of the implementation of their services in their respective areas. For the lower health facilities, these are expected to conduct quarterly performance reviews and share data on implementation of services within their facilities, focusing on indicators for the health service delivery. For the development partners, of course, these are key players in planning, resource mobilization, technical assistance, and implementation of the service delivery within the their respective regions. The community at community level, each facility shall mobilize the community, health resource persons, yes, to support government programs for quality, mobilize sensitize, and open capacity building, including data use. Brief of financing mechanism for this strategy. Regional hospital shall be funded through existing financing mechanisms for the hospital. One, the community health department shall require funds to operationalize the regional hospital mechanism in terms of human resource, office space, and logistics. Yes. Government of Uganda. And the government of Uganda shall prioritize regional support, funding resources from the Ministry of Finance and Peace government. But also, the government of Uganda is also focusing on G2G, which is focusing on HIV, AIDS, TB, and is expected to improve availability of resources for quality improvement, support supervision, mentorship, coordination of services, performance review meetings, and capacity building in the region. Monitoring and evaluation. MRD activities will be carried out to follow up core areas for the regional referral support mechanism, like support supervision, performance reviews, implementation of quality of care interventions. That the public health department of the regional hospital shall routinely conduct data analysis to generate the required regional data and dashboard to demonstrate the performance for informed decision making. Some of the tools for M1E, of course, our HMIS is still the main source of data at all levels of service delivery. Progression model and the HUI database, the HFWAP, that is Health Facility Quality of Care Assessment Programs, which is done annually by the center, but also the facility is expected to do a self-assessment quarterly to track, to check their performance. And also the newly introduced routine plan satisfaction feedback initiative. I rushed through today because of time, but briefly, that I intended to help the regional hospitals execute the relatively new mandate of taking lead in the issues of health in their respective regions. Thank you very much.
Thank you, Dr. Chilima, for giving us the system strengthening support structure. This is existing and part of us already implementing it. We just want here to emphasize that existing structure and seeing how we can adopt to maybe taking it up to the next level in terms of the reviews and then the supporting of the mandate of the regional referral hospital to reach out to the districts. Ladies and gentlemen, having had that, I notice we are now shifting into the final piece of the day, and that is the last bit of the discussion, and then the final resolution of these 2 days. And I know you had quite a lot of discussion. Some of them you have questions, so you will be giving in your key comments as you also give us some key actions and resolutions in this. So, ladies and gentlemen, allow me invite Dr. Achara to be in charge, and Sebunyo, coordinating head of committee of the department. They'll be coordinating this discussion. However, we want to look at making sure you're able to own what comes out of this engagement. And that's why at the end of this meeting, we will be following through what has been, what decisions we will have made. So every meeting has resolutions. And so in this meeting, we will make some resolutions. And as stakeholders, once we make such a joint resolution, we will make sure we own these resolutions and we also follow through. Most of the times we want to share some of the things towards the next meeting, but part of the lessons that we also learning is that we'll be tracking these resolutions on the quarterly basis and seeing how are we progressing. We will share this to all the stakeholders, all the cows, the RDCs, the EHOs, and the other different stakeholders, the trade-based, the cultural leaders. We will be reaching to your gates to see how are we able to drive this health agenda across Karamoja region. So this is definitely owning up most of these responsibilities that we are to commit to today. I think we also, I know we have some questions and also discussions on what partners have been doing, and they also keep comments. So as you make your submission through the chair, so you will have to give it the comments, but also key actions. I also know at the end of that, I'm informed that the Tally Center also, yes, has the district that perform the best in terms of health financing. So we will also recognize you towards the close of this present engagement. And then we will definitely do the final thank you. And then I know this represents you will be seeing how to. So Samson, are we ready? Good. Okay. Let me welcome Dr. Charles to take on this, and Dr. Charles, you're welcome. Dr. Charles, you're welcome to chair this session. As we.
Very much. The JRM. So I will go and invite members to make contribution to your own work. It's not our team. Robert panel, we have Sister Angela, Vicky, Yao, and Irene Neumbe. That is from, she's from Aneka, and Angela is Rotoyo Fellows Pheoc Committee of Department. So they are the ones who have done this work together with myself and Dr. Achab. Out of this work, we are going to produce that nice aid memoir. Most of you. So that becomes our agreement up to the next GRM. These GRMs, and in our entry meetings, we discuss, we will remind the districts of the GRM, and that's what we have been doing on support supervisions. Help on in the implementation. We add the process, we help the process and remind districts on. Then when we come back, Dr. Chad will be here again to take us through what progress we have had. So without further delay, Dr. Chad is now back You will sit there and please hear the session. Thank you. So, so we shall start with the first. I also have to tell you that this is in WHO blocks. So things are arranged in blocks. You'll find leadership, you'll find human resources, you'll find if it is of concern, the big blocks, the 6 WHO blocks. If you don't remember them, you'll see them as because the first block is leadership and governance. Thank you. So the first issue is that we recorded is that there is no representation from the Karamoja members of parliament from the region in joint review mission, despite the invitation. This has gone on now for years. Remember, is that issue well stated? Is it relevant? If relevant, is it well stated? How is the English? The grammar? So if it is okay, then we move to the action. Action, what should we do? What do we recommend? Should we have appoint someone, follow them up, the LPs? Because I have to tell you from my point of view that most of them don't pick their numbers, and thank you. The finance block we added there, the building block. So I will tell you that it's hard to get them on call and email and WhatsApp, and when you go through email, there's no acknowledgement. That's my position. The mic around.
Very good. The representation from the Karamoja Parliament from the region, where it's repetition. Because no representation from the Karamoja Parliament means that by the time you define them as Karamoja members of Parliament, you're already defining the region.
Thank you. Noted. So what is our sorry?
Thank you very much. I know that you really want to be towards this, but because of the passion I have for having everybody participating in this, just taking a leave from Moses from Mount Sinai to come to him. So for us, we have to move to them. So I'm suggesting that we need to have a group of people who can engage them, discuss and tell them why it is very important for us to convene together. Because we know they play a very big role. Most times when we go to the parliament for presenting our budget, we need such support. We need their support. But at times they are aloof. So we need to go to be deliberate. We need to be deliberate and engage them. And I would like to suggest that we have some elders here, some elders who should be able to engage them and just try to them why it is very important for them to participate in this. I would like to suggest maybe Dr. Moro, if it is allowed, and then we can nominate other people. Thank you.
Thank you, Director. We have the other side. Yeah. Thank you.
When I am attending function, say, so and so invite, so and so invite, so and so. So SC5, chairperson of SC5 can also be in the group. Because if it's in the function, you then invite the other member of parliament, or something like that. So the chairperson of SC5. And then too, I would suggest that matching the key issues which need their attention. So, and those kids need to pick this up and then share with them.
Thank you. Thank you very much. As we get to the next speaker, actually, Joseph would be a very good person mobilizing. Next time, shall write to Joseph to help mobilize.
Thank you very much. In fact, I don't know what we are trying to. I'm not understood well, because this is an issue that needs calls for all the stakeholders to move as a team. I was thinking, other than us going to that approach of negotiating or pleading, me, I would think that if there is a task force here for this activity, can I write to the chairman, Karamoja Parliamentary Group, and maybe assign, they look at themselves and assign one person who will be coming to attend this forum as he informs the rest as they see. Because this business of taking a team, these are the people who are accounting, who are supposed to be accounting to the people. So we are like pleading to them and trying to know, and by doing that, they will negotiate in terms of the resources. How much do you give me to come there? Thank you very much.
Thank you.
Kushal, I think as a district chairperson, the issue of members of parliament failure or refusal or absence in this strategic meeting, we shall take it upon ourselves as a district chairpersons so that we can engage them directly. Of course, we shall engage with their boss, their parliamentary group. We shall engage their chairperson that in the event such a meeting is organized, even if they don't all come, but at least there must be some representation. Whether even 4 or 5 MPs, or even their chairperson, or the 26, even if they come 4 or 5 or 6, it's okay. We are going to engage the chairperson of members of Parliament Karamoja on this issue to say it is good for you and also in the region. The voters may think you are not working. So we shall take upon ourselves on that one, I promise. Asante.
Thank you very much. We have Kao Bilatuk. Right behind the
Just say exactly what
Exactly.
So that
Thank
each
you.
of us, each of the districts
Take up a responsibility, each district take up responsibility to engage the MPs and tell them to be part of the mission.
Any Uncle Milton?
On governance and leadership, concentrated more on members of parliament. Yesterday in the discussions, we had people actually proposing affirmative action for Karamoja, but we forgot that affirmative action was much earlier, and even a cabinet post had been created in parliament, in government. The ministry Karamoja affairs. Where are they? Do we still want to deal with kid gloves when we are talking about important regional matters that they actually can propose legislation on and deliberate on behalf of the people of Karamoja? I would have felt like maybe we probably need to include not only just members of parliament, but also the cabinet ministers representing this region, in not only parliament, but also in cabinet. And why, for example, would people would stand up and blame Ministry of Health for an activity which is under the docket of the Ministry of Karamoja Affairs? Why don't we actually engage them and really get hold of them and address our issues to executive and also discuss matters of law that affect our people. Karamoja. Thank you.
Thank you very much, members.
Is there a rapporteur writing those actions?
Yes, we have this. So that as the Commissioner summarized it in a very nice way, and thank you for reminding us, the ministers of Karamoja. So, rapporteur desk, we shall include the minister in this no representation from the Karamoja, the Karamoja ministers of Karamoja affairs and members of parliament. Now we shall move on. That action well taken. Who is responsible? We have agreed and we accept action. And it's very good that LC5 chairman, the district council chairman will follow them up. They speak the same language, they are the same politicians. Thank you. And the time frame verification, we shall clear up with that later. So let's rush to the next. Struggling for number 3 to escape for district boundary population during immunization and other. So we now think that issue relevant or irrelevant. If it is relevant, how is the program? The English is okay? Disagreement. Okay. Disagreements over these boundary stations. That is taken. Rapporteur to the. They have something to say.
In public case, you can only be safe if all your neighbors are safe. So the fact here, of course, I'm cognizant that this is sub-boundaries. But me, I'm more interested in seeing that every person who is immunizable is immunized wherever he is, regardless of the boundaries. So me, this one, I think we needed to tease why do we have to bring this issue up. If at all, if we had all our children immunized, or the people they know. So what is the problem? The problem, yes, we noted yesterday during the presentation that we have all the districts are encouraged for one. Even we still have a big number of people, of children, who are unimmunized and under-immunized. So I think that would be the right that we need to have all those children identified wherever they are, mapped, and then we do what? We vaccinate them. So that will reduce on the risk of this preventable diseases. Vaccine preventable diseases.
Thank you. Thank you very much, Director.
Chair, I want to remind you of an action.
Yes.
There was an action by, I think, that EHO, the use of the LC1 structure, yes, to mobilize for immunization. And because LCs know where the boundary is and where their people are. It was part of the action that was proposed, I think, there, to address part of that action.
Thank you. Noted. So what are the That is the cow or DHO? DHO. Okay, so we move on to the next. That is under the block for, and the first one, the first issue is there. Traffic levels across the region at 60.6% of the approved deposits filled up. Is it relevant or irrelevant to this action plan? Did we adopt it? And if we are, how is the English? And if the English is okay, the recommendation that this is council to customize the new structures, also to make submissions on recruitment plans to Ministry of Public Service, and follow up with the Ministry of Government that took.
I think we would be able
Just help us and remove us to customize the new structure. Because this is something been passed over to us. Therefore, there's no customer.
Thank you.
And therefore, it's just a question of make submissions too, which makes it more relevant.
Thank you. Noted by the rapporteur. So, and council are responsible for that. So we shall move on to the next. And the issue is the organized updates and by those facility staff. Is it relevant? It's an issue, but it is really relevant at this time. It's okay. And English, the recommendation suggests is that duty attendance monitoring and analysis to be done, and the disciplinary action to be taken on chronic absenteeism. It's just explaining we're rushing out. So that the responsible persons here for these health workers, the DHO and CAR.
Chair, in terms of when we talk about duty attendance, what are we going to do? Do we think about biometric machines and in these health facilities? And then because I think that's part of the systems that we are putting on, and the biometric machine is linked to an integrated human resource information system, which is able to generate a monthly report on attendance. And those are the reports that can be used to sanction staffs who are not attending to duty. So what capacity do the districts have to have machines per health facility?
That's a good question. How do the districts monitor? And then is it by attendance books? Okay.
I think what is captured there is also very important. Youth attendance monitoring and analysis using biometric machine. Then you leave it for us to go and apply. And that's what I think we are using currently. Maybe those who have not jumped on the biometric machine should be able to adopt it.
Rapporteur has noted that. So districts attendance monitoring and analysis.
The question we also have is, do all health facilities in Karamoja have biometric machines? What is biometric machine coverage in our health facilities? Do we do that as a commitment that we will procure biometric machines for all health facilities? Because it is the best way, right, to approach.
Yes, I think we have to, because there's already a system for human resource. It's just a matter of already been planned. There is a reaction from the other side. Dr. Court. Dr. Okon. Is already using.
Yeah, thank you very much, Chair. On addition to the biometric machines, you know, human beings have become very clever. They can even bypass that. The spot checks, if you are a leader and you are passing by a health facility, please branch and check what is taking place there. If people know that anytime someone, my supervisor can be able to pass here, they will be keen to make sure that they don't promote organized absenteeism. Thank you.
Thank you very much. And
Yes. To add on that, on absenteeism, yes, I was submitting.
yes, please go.
Yes. On the issue of absenteeism, it's a general problem. Of course, earlier when Dr. Chico was presenting, he talked of the issue of organized absenteeism, but it's not a picture across the region. Some of our workers, they stay in their duty stations because they don't have places to go and moonlight. So this is not a general challenge. You should have mentioned the districts where this is affected. Those topics are across the regions. I see there, some of it is generic. Make submissions for recruitment to Ministry of Public Service, MOH, Ministry of Finance. Our cows have been doing this every year, but we see no action. So we need a stronger point. I don't know if somebody can come up with a good stronger point, but I see what we put there. This is what we do every day, and we don't get results. Thank you.
Thank you very much, Dr. Narime. We are sounding the same drum. It takes us back a bit, just a step back. Could you please just look through it again? This week comes our customer structure. We have removed that. We are able to make submissions on recruitment plans to public service and the follow-up with the MOH and the finance. Now, should we add something there to make it more active? Because according to Salam, it's more passive now. It's not hitting at the mark. While you're thinking of that, you are free by the to get us back to that. We shall move on to duty attendance and monitoring. We said we go duty attendance monitoring analysis by biometric machine. We're suggesting that we go with the system has been put in the electronic system of the place. Thank you.
And in addition to that, to avoid the tendency of absenteeism, we also, Ministry of Health assign key performance indicators. Most of the senior officials, senior staff, borrowing from there, whereby you are assigned these quarterly, annual, or weekly. And work, not just attending, also having outcomes.
Yes, on updating, please note, means of verification. In the verification, we have reference there to the indicators. So that is noted, taken. Now we move on to infrastructure. This is the responsible part of the H1 cow. Infrastructure is the delayed implementation of the Italian cooperation towards health infrastructure development for upgrade of at least 5 health facilities per district. Dr. Nani, this is another old song. Every year we go through the same. We drafted the recommendation that we follow up on the contracts award process with the Ministry of Health. Mike, please.
Thank you. On the issue of infrastructure, first of all, what Italian corporation is giving us is a peanut. Yes, but it didn't have the right information. He said that every district will have like 5 health units upgraded, which is not true. For my district, I'm going to have only 2 health units. And in district like Cotindo, they reported also 1 or 2. So infrastructure, we need affirmative action. Yesterday, I liked what somebody said that we need what we call it compensation. Because the government duped us to waiting for Italian cooperation funding, yet this fund come up to cover up our gap. So as a region, we need starting next year, like what they have done maybe to works. They need to give a billion for infrastructure per district. So that we also use it to upgrade our facilities. Thank you.
Thank you. Just Dr. Rabe, before you conversation, how can we, how shall we put that? Because already to add on to that, the suggestion that we say okay to lobby for affirmative action and compensation for the delay, for the damage we have caused to the lives of the Karamoja people.
Exactly, because we lost up the UPIP projects. As you saw in our presentation yesterday, most districts benefited, like 5 to 10 facilities. So should we build up our case of that? We tell the government that what Italian is giving can't cover up our gaps, and we cannot catch up with the rest of the regions who have already upgraded 5 or more facilities. So they need to top up something so that we upgrade like at least 5 facilities per district.
Thank you. I have to tell members, Dr. Nalibe is always with data, but I have to tell members who may not know that we have, the whole region, we have 5 hospitals, 4 center forts. Those are 9 facilities plus the regional referral hospital. Those are the only places that is plus. By the way, Dr. Kasega, I'm going to give you the 5 hospitals in the whole region, 4 health center forts. Those are 9 points where we get comprehensive obstetric care, where a mother can get a cesarean done. Only 9 points in the whole Karamoja. It is very far when you tell people from other regions that we have 5 hospitals, only 4 center forts, and we have 47 center 3s, only 47. The whole Karamoja and 93 center 2s. It's very miserable because when you go to Kasese district, they have 100 something facilities, just one district. Kasese. So we are missing out. When the national cake comes, the whole thing, they just give a small bit for Karamoja. The rest of all the pie chart goes to other regions. So those are the only 4 points, 9 points where we receive cesarean. And then we are crying over maternity, maternal mortality. But start from how many are accessible to, people are accessible to, just 9. So that is a very serious thing, and that is why we need our ministers here for Karamoja affairs. Thank you.
What Dr. Sariva said is okay, he just noted down remove.
So, rapporteurs, we need in our contracts, we affirmative action for more facilities and compensation.
Let's call it catch-up funding.
Yeah, the affirmative action will be dressed up in funds, not. Thank you. So the responsible person still remains our LC5, but imagine if the minister of Karamoja was there, could have put a minister of Karamoja.
MPs.
And MPs. So next is a slow pace of health facility upgrades to higher levels. We decided to put this apart. We had that coming from you. All this is coming from you. So we had some voice and for discussion now. Maybe if you can check out the English. And then, so we should really take it. This needs to be strike it off. Angela, so we strike this one off. Slow pace of health facility. We keep it. Yes, yeah.
Colleagues, ladies and gentlemen, there's a very important function. I'm seeing people are leaving one by one. Dr. Sagat, you are about to walk out. Please.
So, what we do here?
Let's retain.
Yeah, let us retain that because there are other. It's not only Italian corporation.
So
But Italian corporation actually needs to come up distinctively on its own.
So we suggested that the recommendation suggested was.
We just have action now,
So the suggestion is that we assess the infrastructure for upgrades.
I don't know that we have talked center. Don't you think we need to have a deliberate effort to ask Kalita Health Center for? It should come out because this is it's remaining a small, just making the theater, making it the infection prevention and control. It is, and it will be up and running. So I think we need to put up
And then, thank you, Director. You have reminded me. Out of the by design, it's supposed to the four center for that are supposed to provide comprehensive care, social care, but actually it is 8. Karita hasn't started yet. So we have to do districts, and that one we have private not for profit. Because up to now, ambulance still depends on PNFP for comprehensive care, just like the Park District. The Park District doesn't have a center for. We have been waiting for it really up to now, and all the burden is left for Matan. So those are issues we have to look into. Access to services, we are still far behind. Thank you, Director. And let's just mention there on Rapporteur desk that even out of the 9 facilities that are designed to deliver CMOC, only 8 are able, and Karita up to now has not been, actually the upgrade is not through. That's what I should put, because the Dr. Sagat is out, but to tell you that staffing level is very, very, very low. At one time it was at around 11%. Karita, just after the upgrade. So I think slow pace is good to say so. Now we move on to the adequate water supply in the health facilities. Should we say particular districts or all the districts? All the districts, so it remains, and we suggested that the water supply assessment and geographical mapping of available water sources with possibility of waterizing and connection from the nearby sources such as schools, etc., etc. Yes, mic please to Dr. Dalita.
Thank you, the issue of water access affects us across the region, but I want to interest our partners, UNICEF, because they have been supporting schools in making them access water. They've been giving schools motorized water supplies. I think they need to spread this program also to health facilities so that you can also get this program. Thank you.
Thank you very much. And with that said, I think the recommendation is okay. Should we go with that? Thank you.
I can say something. To say, let colleagues here know that still UNICEF provides these facilities in coastal health facilities and in some selected districts. So maybe it would, maybe the feedback I can take is the scale up and also getting information on where the need is critically is. But I would suggest if we may not adopt it yet, but just encourage and provide evidence where the need is. So in other words, we assess, we do a needs assessment, we quantify the burden properly and present it to UNICEF yeah. So that is taken, we move on to equipment. And before, I would like to tell members who may not know that we have the regional workshop. Repairs maintain referral hospital, and we have a clear mechanism which is tested. It is regional. There is a van to that effect, and we have personnel to handling all types of biomedical engineers. So please don't have issues. We have services available. We don't charge for those services. You just have to let us know that a generator broke down, or we have auto which are broken down, if which are broken down. They will come and do them skills for weighing all that equipment. It's available. So with this lack of solar fridges, Karamoja actually got it from Kabong, and we thought it deserves attention. So it is upon the house, do we go with this issue or we put it in the parking lot? We adopt it. So if we adopt it, what is the suggestion? What's the recommendation?
An additional contribution as far as it is concerned.
3 years?
Yes.
Yes, please.
When we moved in during our joint support supervision, we also realized that most of the facilities don't have fridges in the lab. So we need to plan for fridges for lab.
Thank you. So who is responsible for those fridges in the lab and the solar fridges? Is it all the partners or also the district has to look for resources to procure them?
And while we answer that question, for Robert to agree, just right lack of solar bridges for immunization and laboratory work. Just to yeah. So you can go, Dr. Brian.
Yeah, the question is what action do we have there? Do the districts have the capacity to procure their own fridges?
No. So the fridges, there are two sources for immunization. This goes to UNEP. UNEP has people can do assessments. You even find they already have a program. They have also planned for these things. So I remember the solar-driven fridges, they came and were given enough, but they were not enough. So what we do is we follow up with the UNEP for fridges.
We are not so sure. Maybe the district update us with their gaps. Each district should come up with a list of facilities without fridges.
So when the districts go a list of facilities which are lacking fridges, then that is sent to UNEP.
Yeah, that's not it. Yeah, there are districts which don't have, which completely have no fridges. But also there are some districts which have fridges and they are, so we need to do something about it in terms of maintenance.
Yeah. And like I said, maintenance, we just have to, notify, yes, I'm told, I'll tell member that we have 5 issues left, only 5 issues. That's the service delivery. There are 4 more issues after that. So, pay close attention. Issues. So the fridge issue, yeah. So we move on to service, block for service delivery, which is our last block. Some facilities in the districts as per geographical facility allocation in 22 sub-counties in the region do not have a single health facility. No, for example, we don't have a single facility. We have only a center too. Up to 72% of the facilities are center twos. This has been touched, above, so I would request to rapporteurs to strike it off.
We need to discuss the specific issue of
Yes.
Yeah, I was thinking before you leave the equipment one. Yesterday when we were going to the EOC, I saw a lot of equipment in that block, and some of them looked that they can be used. And it's good you said you have a workshop here. Isn't it okay if we put something here that the regional referral hospital donates some of those the nearby facilities that may be lacking something instead of having them there? Thank you.
Yeah, we have done donations before. We had something ready on the surface. Some things are better when we have gone through the request. But we have made donations to districts before.
Those are really semantics. Depends on whether you went to nursery or not. But for me, what I know is we ensure that we want to ensure access to services, and when we have something that is within the region and it's not being utilized, we give it to a percentage which needs it. So for like this is something that is already ongoing. We have already supported the Bone Nursing School and also Yakabere and the other districts within the region. So we shall assess and see what is available and what is usable.
Thank you very much, Director. So we move now to D2. Under service delivery, and the issue reads that some districts, like Moroto, have not received ambulance. That dash, just in case we forgot someone. So do we go with that or we strike it off? We maintain it. So we suggested that we follow up with the emergency medical services, Ministry of Health. And at least the commission themselves talked about it, the 34 ambulances to be claimed, they are still preparing them. So, and the person responsible is CAM, DHO, and Director Regional Referral Hospital. We put Director Regional Referral Hospital because also Regional Referral Hospital has the emergency medical service regional focal person. Who is in the house actually. So you can know the regional hospital can also help to follow up on behalf of the districts. If that is taken, we can move on to teenage pregnancies. And the deliberation, it was also, it took also attention that is high teenage pregnancies, 13% are making actually teenagers making 13% of pregnant mothers in Karamoja, especially in Amudat, which is leading in this regard with 21.2%, followed by Abimat 18.2%. 21.2% and the Abimat 18.2%. So is it very relevant to us right now? So if it deserves our attention, what recommendation can we draw to address this issue? Yes, Sister Angela.
Yeah, with regards to that, I don't know, where do we put child labor? Where do we put child labor? If we moved around this town or even our districts, that young children are taking care of families, that the ones struggling with the firewood, with the charcoal, burning and selling left and right, and eventually that has a very big impact in their development, growth and development. So where do we put it? It is affecting. Today they are saying, why are they scissoring most of our girls? And it is coming out clearly from the community. They are complaining so much. Remember, these are not the malnourished children who grow up under standing kind of a stage, and then this heavy loads affecting them, and eventually it has impact on cesarean sections. What do we do?
Child labor is interesting. At one time, some members were arguing that if the child is doing work for the household, they should call it child only hired to do labor for someone like that. So it is up to members.
I think sister, another aspect which is affecting children and also exposing them to various risks, but not to downplay this issue, especially its contribution towards. Let's have that one as a separate one, a separate observation, and then deal with this one, because it's the way we deal with the other, like we don't necessarily the same way we deal with this one. So for me, I would like to suggest that we really need to discuss this, because it is increasing. It's now the number which increases the maternal mortality and other complications, more so in this region. So we need to target, and me, I would like to suggest that maybe we need to engage, especially the leaders, to sensitize the communities. These need to take it on, and since it is health now, linked to security, let's take it on and we address that issue of teenage pregnancy.
Thank you, Director. And also to add on teenage pregnancy, these are members have to know that these teens will be more in hiding until the pregnancy is seen. And they end up not attending. These are poor come late, they might attend late. So we get many complications from such clients. So it's a big issue, like the director said, it deserves very special attention. But as members, everybody don't forget the church involvement in this and schools.
Thank you, Doctor. As we move around the teenagers, let's not forget, we're focusing on the teenage pregnancy.
Yes.
Fathers. Because I saw from the presentation, for us who have sons, we're also concerned that there is an outgrowing number of young fathers between 14 to 19. What do we do with that group? And they are there outside there, whether you call them in the mighty area in the town or what. So as we look at this, let's also look at the young fathers. These young fathers, what do we do with them?
Let's put us on young fathers. We will open up a room for them.
Thank you so much. I want to make a contribution on what actually brings up the number of teenage pregnancies in Amudat. And I think I'll also relate it with the Abib. We have what is called fundraisings in Amudat. People call it topic rep. And this fundraising actually has come with another style of dances. So you do this, it goes transnight. It's one thing that's for Kenya, but we are trying to come up with restrictions. So what we request, maybe the security team, is also to take charge sometimes and close some of those fundraisings. We have tried as local leaders, but sometimes the enforcement is a challenge. I also saw in Abim, before I joined politics, I was working for TASO. And I realized in Abim they have what is called local dance at night. You get young kids moving, so these are some behavioral activities which actually raises up such kind of challenge.
Thank you very much. Noted.
There are key actions around there, behavior change, cultural, yes, to influence behavior change. Two, there is keeping the child in school. Those are key actions. Yes, we need to engage all the district stakeholders, including EOs. The other is the law enforcement agents. How do we also enforce law and order to avoid child labor? So all those are key actions we can propose towards that action. We can proceed to the next.
Thank you very much. The next is the low household pit laughing, and the coverage you have in the region is 24%. That is to support this statement. Do we find it relevant? If it's relevant, what do we suggest? Should we have bylaws, ordinances, what? What do we do? Should we take it to the district councils? Thank you, Doctor.
You see, there are some things that hurt, but these are issues that are very simple to handle, very simple. We are in an area where people are prone to hunger. They bring food. You have a CDO. You have somebody in charge of health. Just attach it to benefiting. You don't have a latrine, you don't get food. Because this is how we manage the yellow fever campaign. We don't get. It's very easy. The other thing is that people are scared and talking the truth in whatever. It only calls for people to be heard. Unfortunately, even some politicians at local level, they don't have latrines. They didn't have a latrine. Now, how are you going to tell people that you have a latrine when you don't have a latrine? So we need to start from those, that when the time comes for leadership positions,
We must harden on some of these people and call the radio that please do not vote for a person who does not have electricity. Yes. These things are happening everywhere. You know, I was in a patch. In a patch, if you did not have 4 acres of cassava, you don't qualify for a government program. Now, why the issue is that we are massaging this thing. And sometimes when we look at what are the sample doing, because there's a lot of money rotating here.